We're going to go through an abdominoplasty markup today with this patient. This patient doesn't require an abdominoplasty, but it's a good example of where we do the placements. Obviously we want to keep the scar as low as possible. So firstly, I'll mark a midline vertical drawing straight down through the belly button, all the way down through to the pubic bone, like so. I normally would draw a circle around the belly button because that gets excised at the start of the procedure. I then have a feel for the hip bones, and I put a dot on each point here just to mark the prominence of the right hip bone and the left hip bone. Okay. Now in terms of the placement of the bottom scar, I would normally measure about 5 centimeters above the external vulva, which normally corresponds to just below the cesarean scar. This lady has had a previous cesarean. So normally I'd mark around about 5 centimeters below and draw a line across the middle like so. And typically this is done below the cesarean scar. Depending on the size of the abdomen to be excised is how long the scar actually placement is. With a thinner patient, it is a shorter scar. With a larger patient or larger abdomen or abdominoplasty to perform, you'll see that the scar goes out a little bit wider. Generally, we want to curve around the groin crease past the hip bone to meet up into the middle here. I want to keep equal cuts on both sides, so I'll measure the distance of that incision, which is 21 centimeters, and I want to replicate it on the other side like so, going past beyond the hip bone. So we join that across here like so. Again, to minimize dog ears, we want the cuts to be of the same length, so from 21 centimeters down the bottom, I also want to be around about that same length up the top. This top cut will come across usually 1 or 2 centimeters above the belly button and then back down to the other side. Because we want to keep the scar low, you can find if it's quite tight, the closure, that the pubic area, maybe some of the pubic hair, can be lifted up a little bit onto the bottom of the abdomen. But again, that's part and parcel of keeping the scar as low as possible for the surgery. Thank you.